what else that I want to talk about? I think the other thing that I want to talk about is managing your expectations. I am sometimes concerned when I see some of the talk in videos and online in regards to people who are going for surgery or who have had surgery and are disappointed. And I had plastic surgery, so I'm not saying that you should not do whatever you want to do to improve your body with surgical intervention. But what I want everybody to understand is a surgeon is never going to give you that perfect 18-year-old nubile ready for the cover of Vogue magazine body. That's just not going to happen. And the further out you get, the older you are, the less elasticity your skin has, the slower you're healing quite often as we get older as well. You need to be very cognizant of that. My doctor was very good about saying to me, Denise, you have a lot of flesh on my rear and hips, right? And in my back. Now, it's not a lot. I mean, I've seen a lot worse, and I'm okay with it. But his concern was that I would wake up post-op and see potentially, he said, you might have a little bit of a fold of skin, and just behind my hips, kind of, right? Post-op, because it wasn't a 360, and he wanted me to be aware of that. And my response to that, I really truly did not have any major expectations as far as how I anticipated it would look. I said to him, anything has got to be better than this thing hanging in front of me. And I truly, truly meant that. Anything has got to be better than this flap of skin and fat slopping down against my thighs when I lift it to dry under it after a shower, or flopping around when I'm doing my walking and my exercising, right? So I said anything will be better than what's there right now if you take this off, right? So having that 9 pounds gone, I truly, it doesn't matter what it looks like. I don't care if my scar is the ugliest, most knotted thing in the world. Having that flap gone, being able to sit in a chair and look down and see the top of my thighs, amazing. So, but I want you guys to be aware of that. Like, don't go into this with unrealistic expectations. The other thing I want to talk about, and it surprised me because I should have known this. I worked general surgery for several years, so I looked after people who had all sorts of thoracic abdominal surgeries. I worked plastic surgeries for 10 years, for goodness sakes. So I looked after patients who had abdominoplasties and breast implants and lifts and reductions and all sorts of grafts and stuff. I did not know this. I didn't know this. Girls, guys, when you have this surgery, you are going to lose sensation. So currently, from just above my belly button, my newly located belly button, down to just below the top of my mons, I really have nothing for sensation. When I run my hands over it, I can tell that I'm touching it. There's the pressure when they clean it, doing the dressing, when they're drying it off after rinsing it with the saline. There's something, but it's not normal sensation. And the same is going to happen if you choose to have a breast lift or implants, okay? You are not going to have sensation in most of your breasts or your nipples. And I would hope that the plastic surgeons are very clear on that when they meet with you, that because of how the incisions generally come around the bottom of your, sort of in a half moon shape around your breast, but then it's sort of a T incision that goes up to your nipples and around your nipples. Then they pull your breasts in, sort of place the implants, whatever, and then sew it back up and sew around your nipples. By virtue of having cut and detached all of that, what they've done is they've cut through all of the nerves, much the same as they have in your abdomen. So, and I'm not discouraging you from doing that, but I would think long and hard, because I quite enjoy the sensation in my breasts and nipples, and I wouldn't want to lose that. And so, even though I had been considering getting rid of the side boobage on my boobs, knowing what I do now about the way this feels in my abdomen, I don't know that I would do that. However, that's a choice that each of us has to make individually. And for some people, that may be important. And certainly, I didn't realize preoperatively the emotional impact having this surgery was going to have on me post-operatively. And I will be very honest in that, because I really, I wanted it gone, because it was a pain in the ass tucking it in when I was putting in pants, or trying to fit pants that fit everywhere else but didn't fit there. Finding clothes that always hit that stomach, because it made me uncomfortable. I know many people will wear clothing that is very snug fitting even when they have a large panty like I did. I wasn't comfortable doing that. I needed to have a long top hiding it. The compression panties, which are hot and uncomfortable when you're exercising or in the summertime. All of those things. I didn't realize how emotional it would be the first time I looked in the mirror post-op and that stomach wasn't there. And I mean that in a positive way. Because even though I have a fairly stable and good sense of self-worth, self-concept, I think, at this point, I truly understood what it meant to feel normal. So I was standing there. My sister-in-law and her aunt were on either side of me. And for the first time in my life, I didn't feel like I was so much bigger than everybody else in the world. And I know that that wasn't true, but this stomach, there was a part of me that still felt that. And to be standing there and feeling like I was the same as the two of them and everybody else in the world, it was quite emotionally impactful. Is that a word? In a good way. And I honestly didn't realize that I wasn't expecting that kind of a reaction. So I truly do understand if people decide, I mean, you need to decide what you need to do from a plastic surgery point of view. But I just want you guys to know that it may not be as important to have sensation in your arms. And I still might get my arms done, but I honestly don't think I will ever get my breasts done, simply because I would miss the sensations that I have in my breasts and nipples. And it's not bad enough that I, maybe that will change down the road. But for right now, I don't think I will. Now, some of that sensation does sometimes come back, but quite often it does not. I've talked to people who are 2, 3, 4 years out, and they still have no sensation in their nipples and breasts. Sorry, I just woke up, but I want to get this done.